Hey, good morning, everyone. Welcome to UroNurse. I am your host, Vic Sinise. Nice to see everyone. We come to you every Saturday, and I mean every Saturday at 9 a.m. Central Time. If you're watching us live, you could be on YouTube, you could be on LinkedIn, you could be on Facebook, you could be on YouTube. And new to the show, as I said, we started going on Kick. So if you're watching from any of those things, welcome to the show. If this is your first time checking out the show, be sure to go to our website at uronurse.com. Best place to learn more about the show. Check out our sponsors to the program. You got a quick link to their websites and all our other podcasts. And most importantly, all of our past 150 episodes. We've been doing this for 150 weeks, never missed one. So check out the episodes, the past episodes. Also, some of you like to listen in your car. You got that long commute. What makes it go by faster than UroNurse in the car? Our audio podcast comes out every week with the show. Comes out about a half hour after the show finishes airing. And it's available on all those things you see over there. Podcast, Apple Podcast, Spotify, iHeart, Amazon Music, and YouTube Music. All subscribe to them, and you'll get it delivered right to your mailbox. Hey, we got a great show for you today. Chris Wiesman is going to be joining us from HR Healthcare, talk about everything you need to know about that. So let's go ahead and bring our experts on. Welcome to the show, everybody.
Morning.
Good morning, Vic.
Let Lori give her introduction for us right now, since one of my great experts. Lori, tell them all about you.
Good morning, everyone. My name is Lori Atkinson. I'm a certified urology registered nurse. I have been in urology since 1998. I currently work for Northwestern Medicine in Winfield and Geneva, Illinois.
Great. And couldn't do the show without you. Glad you joined us every week. And Chris is our special guest expert today. Chris, give us your introduction. Tell us a little bit about what you do.
Thanks, Vic and Lori. Nice to see you. Chris Wiesman here with HR Healthcare. We are a medical consumables manufacturer based out of York, Pennsylvania, specialize in many different products, but relevant to today. We have a very robust urology portfolio, and want to just going to talk a little bit about what we're doing out there in the market, and most importantly, a new e-prescribing platform called Loop that we've recently brought to the market.
All right, great. So let's go ahead and bring up your slides and take it away, Chris.
All right, thanks, Vic. All right, so just a quick intro to HR Healthcare. You may have heard of us, you may not have heard of us. We are, again, based in York, Pennsylvania. It's a professionally managed, family-owned business, about 200 associates, and really specialized, like I said, in that development, the manufacturing, and the supply of healthcare consumable products across the continuum of care. What we strive to do each and every day is to live out our purpose, which is to positively impact people's lives, and that's through products and through the service that we deliver. And again, today, excited to talk a little bit about our urological solution and what we're doing in the market, and again, this new innovative and patented e-prescribing platform called Loop that we've recently launched to the market. Next slide. All right. So again, when we looked at the market and kind of the current state of things, it's a little bit of a fragmented market out there, and you've got your catheter manufacturers, you got these litany of suppliers out there, and it leads to a lot of confusion on the patient side of things, and also just the way that catheter orders are sent out so that patients can receive their supplies when they leave the urology office. There's a lot of back and forth that really burdens the office with making sure documentation is right. And so when we sat down and looked at all that, we was like, how can we solve these problems? Whether it's a little problem that causes a little thorn in the side, or it's a bigger problem that impacts the a nurse or an MA's ability to, focus on caring for the patient, or, a patient's ability to receive those products. And so we really wanted to be intentional in how we did that. And so, what we call it, the HR healthcare urological solution. It's our approach to urology care. And, it's really based on the 3C framework, which I'm going to talk about, being cohesive, being coordinated, and being connected. And, when I say connected, it's healthcare professionals, it's the patients and their caregivers, and just really pulling that all together. Next slide. So to dive into this 3C model a little bit, and what we're doing out there for HR healthcare, again, cohesive, coordinated, connected. And, when we say cohesive, what's unique about this is all facets of urology care that we provide to the market are under one company. So you have HR healthcare, that's the manufacturer of our products. We have the TrueCath catheter line. This is a very robust catheter line, everything from, your ready to use hydrophilics down to your uncoated catheters and then, a full suite of urological products or accessories, your leg bags, your drain bags. We have securement devices. We have Foleys. So we cover every aspect of urology products. Also, we have another brand called the Easy Series line. That's our line of closed systems. Really unique line of closed systems that have, some proprietary features in there that, really geared to folks with limited dexterity, but also, your line of closed systems that, able-bodied folks can use if they are struggling with infections or whatever the case may be. But again, so that's the HR healthcare side of it. And then, related, we have our supply division, which is HR healthcare patient services. And that's where, patients come and we bill their insurance and we provide the products to them, all over the country. And, when we looked at it, a lot of times you've got X manufacturer that's in an office, and then it goes to either a related or unrelated supply company. And, from a patient's perspective, they're new to this, it's like, what do I do? How do I get these supplies? How do I use them? When do I get reorders? And, they're getting, they get this product, they see, whatever the brand name is, whatever the manufacturer is, and then they're getting a phone call from a completely different entity. And a lot of times they don't pick up because they're confused. And so what we wanted to do was really just solve that. Again, not crazy revolutionary, but we wanted to just have it all under one name. So when a patient receives our literature in an office or our products in their office, and then they're getting a call from our supply company to be able to process their order, bill their insurance, and ship those products, they have that continuity. And so that's really what we're doing under the, the cohesive side of things. From the coordinated side of things, when we looked at it there, we want to really deliver white glove service, both to the urology office and to the patients. And, a lot of times when, at some of these other suppliers that are out there, they're large and these folks are just a number. And we didn't want to have our patients be just a number. And we didn't want to have our, referral sources and the nurses that we work with out there, who do I call to get this resolved? And so we have a single dedicated team. And what we do on our patient services side and on the HR healthcare side is they all work together as this dedicated care team. And we have several care teams under the umbrella. And, as the patient count grows, the care teams expand, just to make sure that it's balanced and we can really deliver that white glove service. And each care team has, dedicated customer experience individuals that are very, well-trained and, tasked with just delivering that, white glove, top-notch customer service to both referral sources and to patients and end users. We have medical records specialists on each one of those care teams. We have insurance specialists on each one of those care teams. So, when a urology office works with us, they get assigned to, or they work with a dedicated care team. So if there is a question about a medical records, or if there's a question about, hey, a patient and, their supplies, they know exactly who to call to. Obviously, our territory managers that are out there in the field doing a great job delivering, great service, visiting these offices on a regular basis across the country, are always there to support. But, they've got, a territory to cover. And what we wanted to do through these care teams was really give the referral source that dedicated, touch point so that they can solve anything that they need to solve to deliver that care that they want to deliver to that patient, and make sure that patient is cared for and taken care of and receiving their supplies. And then relatedly, the patient, when they call into HR Healthcare Patient Services, they stay with that care team. So every month, whatever it is, whenever they're getting a reorder, or if they have a question, they know exactly who to call, and they're talking to the same person every month. And, it's different. It's a costly model to deploy, but, we when you look at the state of the market, and how frustrated patients can get with this because it's something new to them, and then they're inundated with calls, they don't know who to call. And so we just wanted to really get to the root of that and solve it with these dedicated care teams. And then most importantly, and really relevant to today's podcast, is connected. And we're pulling it all together with our proprietary and patented e-prescribing platform called Loop. And this is just a really innovative technology platform that we pulled together. We did a ton of market research, analyzed the state of everything that's out there, and just really dove in and said, how can we make it better, more efficient, and ultimately deliver better service to the referral sources and to the nurses that are out there who are working tirelessly to, take care of these patients with heavy patient loads, and also to the patient to make sure that they're getting their supplies on time without issue, and, also have resources available to them should they need them as they are, start this journey of self-catheterization. Next slide. So this platform is called Loop, and it's powered by HR Healthcare. And again, very excited to introduce it today. We launched it about 45 days ago to the market. We've had great receptivity at the referral sources and at the urology offices that we've introduced it to. Nurses have really been fast to adopt it, and it's picking up and no signs of slowing down. And again, and I think as you see today, the features that we've built into this, and we're just getting started. The first phase of this was to build out the solution for the urology office. Shortly in the next couple months, we're going to be adding in additional features for the urology office to continue to solve some of the common pain points that they experience with sending catheter orders out to suppliers to be able to process them for patients. We're having a full patient-facing aspect of Loop. So when a patient gets or is prescribed a catheter, they're going to be able to easily see, the status of that order, have resources available to them, ask questions. So it's really exciting to, and that's kind of why, or one of the reasons why we called it Loop, because we're bringing that whole process together. So before we get to a video on Loop, a little introductory video, when you look at the state of e-prescribing in urology, it really hasn't gained the adoption that other areas have gained. In 2024, 92% of all medical prescriptions were filled with e-prescriptions. But then conversely, when you look at orders in the HME industry, 92% of them are still being done with fax or manual processes. And, there's probably many reasons for lack of adoption, but when what we heard and what we continue to hear is with the urology, the solutions or the different offerings that have been out there prior to Loop coming to market, where it's still a manual process. It might be like a digital platform or a web-based ordering platform, but you still have to type things in. You still have the documentation challenge where, say, hey, I want to prescribe a Coude catheter, but I might have been really busy and I missed the justification in the chart note to support a Coude catheter, unable to pass a straight cath. That's not there. Well, the supplier can't bill for that until it's there. They can't get paid by insurance until that chart note is updated, forcing them to come back in. So, there's still, with everything that's out there prior to Loop, again, very manual, typing things in, and still very documentation heavy, a lot of back and forth. And people are like, well, heck, why don't I just fax? It doesn't, these digital platforms really don't do anything to solve my challenges. So I'm just going to stick with the status quo. And so as we looked at that and started to really build Loop from the ground up, this is something that we developed from the ground up here at HR Healthcare. We wanted to really solve all those. And again, as we've shown this and gotten this out into the market, the receptivity has been very high. And I think, by and large, that's because they're seeing, oh, wow, there is a better way to do this than faxing. And you guys have actually finally solved that. So I'm excited to introduce Luke to the UroNurse audience today. So Vic, go ahead and roll the video.
Healthcare professionals, patients, and caregivers are inundated with information and complexity while navigating urology care. Managing catheter orders is just one piece of the complex puzzle. With this responsibility comes workflow challenges, including incomplete or unclear information, sometimes what feels like endless clarifications, and even delayed approvals. Every minute lost to managing this process diminishes the capacity for direct patient care team collaboration, and addressing patient priorities. We listen to the needs of frontline staff, prescribers, supply management personnel, and patients, and developed a patented tool equipped to tackle pressing pain points. Introducing the LoopCare platform powered by HR Healthcare, a cloud-based interface with a dynamic framework designed to progressively advance functionality. The Order Autosave feature lets staff pause and resume work seamlessly, enhancing productivity. Proprietary smart technology recognizes and imports patient information from face sheets, chart notes, or other documents, drastically reducing manual input requirements. The validation step helps prevent discrepancies, incomplete orders, and supports compliance, eliminating administrative burden and ensuring timely processing. A centralized order history organizes essential tracking and file references, accessible across multiple users and sites. Search, sort, select. Secure data encryption, role-based access controls, and audit-ready protocols provide safeguards and ensures order integrity. Loop orders automatically route to HR Healthcare patient services for efficient medical supply processing. Minimize frustrations. Maximize your time, optimize your workflow. Experience the power of the LoopCare platform.
All right. Vic, can you throw back up the slides? All And do you mind going to slide 6, please? All right. So that's a little bit about Loop, a nice little explainer video. And we're going to dive a little bit deeper here into some of the key features. But just, from, the highest of high levels, this platform is, again, it's really designed to streamline and connect those critical elements of urological care, really around catheter orders, and that gap that is out there between the processing and those other essential aspects of patient management. Next slide. So again, so this is just a slide and kind of like that highlights a lot of those key features that were fleshed out in that video. And just a couple that I think are relevant and want to talk and highlight during the podcast today. So the first one is, accurate and efficient. So this is our proprietary smart technology. And so what you do in Loop is, take the patient documentation, and demographic information out of the EMR and put it into Loop. And it has this smart technology, and it reads it and it scans it, and it automatically generates a catheter order for you. It'll fill in patient name, address, date of birth, office visit date, insurance information, and extremely accurate, and does that. So now you do one quick drop in, and that whole order is generated in about 20 seconds for you. No more typing, no more, writing on a fax form. And then it's on the side, you work through each step of that catheter order, and you can be from start to finish in about 1.5 minutes to 2 minutes. And as you get more, proficient in the platform, probably even under 1 minute. And then, once you get through the patient information, the insurance information, and, the frequency of use, and those other preliminary fields, then you select the product. And what we did here, it's a little bit different. We kind of deployed like a marketplace feel to it. So you can do one of two things. You can do a quick select with your product. Say, hey, my patient needs a 14 French catheter, and I want them to have a ready-to-use hydrophilic, or I want them to have an uncoated or a water sachet hydro. Boom. Okay. You just click the attributes of that. I want it to be standard length. I want it to be a firm or a regular catheter, not a soft catheter. You pick the French size and move on. It's very quick, and you can have that product added to that order in no time. And then, or you can do a little bit more, of a shopping experience with the products that HR Healthcare offers. And, it's got the pictures of the products in there, and then you can select that, and then, choose the features or the attributes of that product for that patient. Again, the French size, the length of the catheter. If it's a closed system, do they want a 700 ml bag or a 1500 ml bag, stuff like that. But then the other thing that's really nice is, there's no guessing on accessories. When you select a product, all the accessories that are related to that product. So if you get an uncoated catheter, lubricant, it automatically populates, and you can then select, hey, I want my patient to have a tube of lube. I want my patient to have a packet of lube. And, it fills in the number of or the quantity that patient can get for that accessory. Same with like you did, or if you want to have like an external catheter with like a leg bag or a nighttime drainage bag or a Foley catheter with that, or a Foley insertion tray. So that's all right there. Very intuitive, very user-friendly, great user experience built into the platform. Most importantly, is when we looked at the e-prescribing platforms that were out there, they didn't get to the real root of the challenge out there. And I've kind of alluded to that earlier in the podcast. That challenge is that, these urology offices, the nurses and the MAs that are sending these orders out, they're super busy. They're just inundated with patients running around and, getting these catheter orders. And look, there's always gaps in documentation. Even the best of the best has, a lapse in documentation. So they want to prescribe a Q-day catheter, and they inadvertently forget to, have the justification in the chart note where the patient can't pass a straight tip catheter, or they have a closed system and they want to prescribe a closed system. And, it doesn't have the, justification there where the patient is, based on the LCD, or, that the patient is immunocompromised. And what this does is they send that order out, but the supplier can't process that order. They can ship the patient the product, but they can't process and bill for that order until that documentation is updated. So you're having the reps go back into the office, and they'll say, hey, I need this chart note updated. You got to find the office visit where that patient was prescribed a catheter. You got to go in, update the chart note, sign the addendum, attach that addendum to the patient file. So everything is, straightened up on your end as well on our end. And it's just a huge burden and back and forth. Like, I've been in offices where I've seen stacks of catheter orders that are waiting for addendums to be signed. And, we were like, there's got to be a better way to do that. And so what we do is, and again, this is, a patented feature of Loop, and, really, one that's just been so well received out there. When you emit an order through Loop, it goes through based on what you put in there. So if you prescribe that patient a Q-day catheter, it automatically validates that order to make sure that it's fully compliant with Medicare requirements. And Medicare, that sets at the top, and all your Medicaids and your commercial payers kind of follow Medicare. So we make sure that order is compliant to Medicare. So when you hit submit through Loop, there's no back and forth. That is a fully compliant order. You'll never have to see another rep about that order unless, you've got like a change in frequency or a change in French size, something that we just can't control that, that needs, an update. But that's all easily done through Loop. And, we can quickly send that amendment or that addendum back to you to sign to support that, change to deliver the care to the patient that they need for their catheter. And then, two other things that are really unique about Loop, again, as you saw in the video, that autosave feature. How many times do you start an order, stop an order, start an order, stop an order, and you're like, and then you have to start all over because there was no autosave. And, the nice thing about Loop is when you start an order, it sits in draft status. And if you have to go away from your desk because you got a patient that you need to go see in a room, and then you can come back and you can fill that order out. So that's, again, a really great feature that just eases the burden on the nurse and aligns more with their workflows and their very busy schedules that they're having to, engage and undertake dealing with patients in a urology office. And then lastly is, there's a great dashboard where you can see all the orders that you've submitted. So if you ever have any question, you can go in there and easily search, for that patient's order, and it's right there at your fingertips. Next slide. So that's all I have today to introduce Loop. Again, it's was very methodically built, thought out, a lot of, insight and, evaluation in the market with all key stakeholders. And it's been, out in the market for about 45 days with our reps, which are, strategically placed all over the country. And the feedback has been amazing. And if you think Loop could be of value to you in your practice, or if you're interested in learning more about Loop, you can email loop@hrhealthcare.com. We can provide some additional information and also schedule a demonstration for you in your local office with our local HR Healthcare sales representative. So thank you for the time today. It was great to come before this audience with Vic and team. And if there's any questions, I'm happy to take them now.
Forgot to take off my mute. That was great. I've got a few questions. So the loop system, is that working as a separate program through your company? It's not on our EMR, correct?
That's correct. It's a web-based platform. There is integration capability, and but when you look at integration, it's a little bit of I'd say misnomer, if you will, we're always happy to have the integration discussion. But generally what we've seen out there is it just kind of sits as a sidecar to the EMR and works in conjunction with the EMR. But it can also be, there's ways to integrate it into the EMR where you can send documents to the Loop platform.
Okay. So because of the notes and things that it's checking, are you just like copying and pasting those into the program, or?
Yeah. So there's various ways that we get those. And, but what we've seen is most of it's done through print to PDF, and then you drag and you drop them in there, or you can take a screenshot of them and drop them into the Loop platform.
Okay, good. All right. So, Lori, what do you think? Any problems in your office with? I know we always got these complaints coming back. We're missing this. We have to send in more information. Not sure if you experience the same problem, but it seems like it's the big problem is you try to order something and you can't get it because something's missing in the notes.
Yeah, you had a lot of challenges that we have in the office for sure. The one thing that I really liked what you said is that people can reach out and get the same person every time. Because it's just like with our patients, we try to see the same people that we kind of see because it's a comfort thing. And then they know that you'll take care of them. So I like that about it. Yeah, it's definitely a challenge about, I don't know how many times I've had to go back and say the patient's going to catheterize indefinitely over and over, or the reps reaching out to us and trying to fill in, or we have to add stuff and then reprint and then fax or, what have you. So yeah, this seems like a really good program.
And you just recently rolled this whole thing out, right, Chris?
Yep. We launched it about 45 days ago or so. And Laurie, I mean, the problems that you have highlighted in Vic in your prior life, now that you're retired, congratulations again.
Thank you.
That's just what we hear time and time and time again. And, as we were developing this, we were like, how do we solve for that? And, that was like one of the big things that we wanted to solve for. And that's, I think, one of the big things that's driving the adoption and the interest in Loop.
Yeah. And those of you that are watching live, I know there's some out there, feel free to put any questions in the comments and we'll be glad to ask Chris those on air so that we can get those answers for you. Now I'm going to kind of get I call it the elephant in the room. Nowadays you read so much about the issues with patient privacy, HIPAA, of course, and we're sending private information to your servers through this Loop program. What assurances do we have that HIPAA is being complied with? Is there BAAs that are those business associates things formed? What say you?
Yeah. No, great question. And so obviously that's a concern and one that we wanted to solve for in the development of Loop. So first and foremost, it sits on a HIPAA compliance server through Amazon Web Services. They've got a full HIPAA compliance server that they offer to folks that have to deal with HIPAA like us, and all the different features there to be able to make sure that you're fully compliant with HIPAA and lock things down in the event that there is a breach. So you have that. And then You also have the role-based access and all the secure platform, and then when it comes to a BAA, you don't need a BAA when you're dealing with a manufacturer. But if a office is of the view that they want a BAA, we're always happy to have a BAA with the office. I've had that come up one time so far in the offices that we've dealt with, and it was very easy to get one of those in place and make sure that they felt comfortable with that. But yes, it's fully HIPAA compliant and all the and secure, and you have each user has a login, a dedicated password, and we encourage them to make a strong password so that it's not easily replicated. And on the back end, then we're always monitoring and doing what we need to do from that HIPAA compliant standpoint to make sure that there's no no issues there, and no patient information has been compromised.
Yeah, very good.
I have a couple of questions. First, if there's reps in our area, do they come out to us? Do they do some kind of demo or anything like that?
That's a great question, Lori. So yes, our reps are introducing it to urology offices across the country. We've got about 22, 23 reps out there in kind of key markets around the U.S., always expanding. So they are introducing it. The way that we are actually doing so once it's introduced and you say, hey, I want to go with Loop, we've kind of taken more of like a technology sales approach here. When you're doing, if you go and you buy like a ERP system or like a human resources system, they have a very, once the account or the sales guy gets you on and you want to move forward, then it goes more to like an account management team and an onboarding team. And so what we've done here is if you want to move forward with Loop, then we have a team here on the back end. Obviously, your local territory manager is there to help and to troubleshoot and to do anything that, just be a great resource. But on the back end, we have Loop customer success management team. And so they set up training and it works best when you have like an order ready to go, and they'll walk you through, you'll get an email, you'll get your login information, get everything set up. You can assign, who is the practice administrator that's going to kind of be the Loop super user. And then you can put all your different users underneath there, all your prescribers in the Loop. And then once you do that, this customer success team, they do a dedicated training. It's virtual. A lot of times our local rep is there to support as boots on the ground while the virtual training is happening. And we just work through it and answer any questions. And then we also have a really great troubleshooting guide that's available in the Loop platform. It's a digital brochure that has everything in there and and you name it, you can troubleshoot it through that brochure.
Thanks. Also, what's the turnaround time for patients to receive products, and are they offered a variety of products to try? How does that work?
Yeah. So the turnaround time, the nice thing about that is we get an order in, everything is squared away, and we can bill and ship right away. So patients are getting products, very quickly. We're like, HR Healthcare Patient Services is like every other supplier there. You enter in the order through Brightree after it comes through, and then it's shipped from a warehouse to that patient's home. Those warehouses are not our warehouses. We work with the wholesalers that everybody else works with. And once, those warehouses are strategically placed throughout the U.S., so you can reach a patient in 1 to 2 days with those orders anywhere in the U.S. We offer them a variety of products. Obviously, this is an HR healthcare platform. HR healthcare, we've got great products, whether it's our ready to use in our TrueCath Oasis. We have a pre-gelled or pre-lubricated catheter under our TrueCath Swift. We have your water sachet hydro. We have your uncoated. We have our whole line of Easy Series closed systems. So we we work with the patient. If it has a specific product that they want in there, we'll say, okay, when we call the patient, we talk to the patient, hey, this is what has been specified. You're good with this. Do you have samples? Have you tried it? Does it work for you? If not, do you want to try a different product? We work with them. Obviously sometimes there's some insurance concerns there, where they want the Cadillac, but they can't get the Cadillac because of the insurance and the way that is. So we work through those challenges with them. If there is a specific brand outside of ours that they want, we certainly can, honor that. But this is an HR healthcare platform, so you'll see that our products are very prominently featured on the platform. And when you look at our products compared to other ones that are out there in the market, they go toe to toe with everything that's out there. They have all the features and benefits and have had really great adoption across the country. Obviously, we're just a little bit newer to the game than some of our competitors that have been out there doing this for 10, 15, 20, 30 years. So they're not quite as well known, but as folks get to know them, whether it's on the patient side or on the referral and urology nurse side of it, they're like, oh yeah, these are really good products that work well for my patients. So the long answer to that is we do offer a variety of different types of catheters within our brand portfolio. But if there is a specific catheter that a patient needs, we do have the ability to provide them with that.
So is HR the manufacturer then for these catheters and intermittent caths? And
yep. Yeah, so we are a very robust manufacturer, growing, and with a great line. Again, that's our TrueCath line. So everything from your uncoated catheter up to ready to use hydrophilic catheter with great lubricity and some other unique or different features on those products. And again, we're very happy if anybody's unfamiliar with HR healthcare and the TrueCath products to send samples and let you try them and learn more about our portfolio. You can also visit our website at hrhealthcare.com and see our full line of urology products there. And but yes, we are the manufacturer and do have a very robust portfolio. Not only do we have the intermittent catheters, something that makes us a little bit unique. There's only one maybe other manufacturer out there that really addresses the indwelling catheters as well. So we have a full line of Foleys that are really great Foleys as well. And, all the accessories that go with that, the insertion trays, your leg bags, your night bags, and whatnot.
And for the indwelling catheter, are they latex or silicone or choice of either?
Great question, Vic. So we have both. We have your silicone elastomer coated latex, and then we also have your 100% silicone catheter. And then something else that's unique to us is we have the, which Vic, I believe you're familiar. It was the Oasis medical, the Duet catheter, the dual balloon catheter. We've since rebranded that to the TrueCath Duo. So that's the double bubble catheter, Foley catheter. And, if you've got a patient who is using a Foley for a longer period of time and, they're having challenges with, it's irritating and bladder spasms, infections, this technology here with that bubble that sits over the tip of the Foley to really create that landing pad for the bladder wall as that bladder's aspirating is something that's unique to our portfolio and, has really been, picking up a lot of steam in the market for those longer term Foley users.
Yeah. And if you don't know about Duet, go and look at our past episodes because we did a whole episode on the Duet catheter. And it's, I think it's a remarkable idea, especially for people with those long-term catheters. And the other thing is we've also talked about chronic catheter issues on previous programs. And Todd Thompson, who's kind of the guru of catheters, had mentioned that the silicone catheter is your best if you're having clogging issues, etc., to utilize. So I wanted to make sure you carried all of those.
Yep. Yes. Silicone will resist that incrustation and that buildup more so than your, silicone, elastomer coated latex catheter. So, just kind of depends. There's use cases for a silicone elastomer coated latex, and there's use cases for 100% silicone. And so we offer both those.
Ah, great. Any other questions that you have, Lori? Our audience is quiet.
Yeah, they're very quiet today. No, I don't have any questions. Thank you very much. This is great.
Yeah. Well, Chris's great presentation. And as you mentioned, they can go to your website to get more information. They can go to my website, UroNurse.com. There's a link from our website, because you're one of our sponsors, to your website. So that's an easy way to find it in case you can't remember HR healthcare. But it's been I think a lot of information. I'm really interested to see how this loop system starts to really play in. I think that's going to be a big plus in the future going forward, kind of get these catheters into the hands of the patients who need them without all these delays that insurance companies are constantly throwing in the way. All right, next week.
This week, UroNurse is joined by Dr. Mia Mage, a clinical neurophysiology and urodynamics specialist from Cairo, Egypt, with expertise in pelvic floor biofeedback and chronic pelvic pain management. She explores the often overlooked and frequently misunderstood condition of chronic pelvic pain in men, offering clinical insights, diagnostic approaches, and therapeutic strategies. Join us on June 21st at 9 a.m. Central Time to learn more.
So yeah, join us next week for that presentation. This is somebody who reached out. I reached out to her when I connected with her in LinkedIn and found out that she does pelvic floor and biofeedback, but she's from Cairo, Egypt. So I'm curious to find out, how do they do things there? Is it different? So join us next week to learn more about that. Lori, always a pleasure having you on the show. Chris, glad you could come up and give us your expertise and share this with us. And for all you that are coming, we'll see you again next week on UroNurse.com.